Hi, my name's Bonnie, and I'm joined tonight by Dr. Angela Fingler. She is a doctor of traditional Chinese medicine with a specialization in fertility and women's health. So I thought, I'm curious about a lot of these things, so you might be as well. You might enjoy the answers as much as I did. So Dr. Fingler, I was a little interested in when a woman gets pregnant. We hear about the stories, we hear about all these different challenges during pregnancy.
It's not always comfortable.
Well, it's not always very comfortable. You should be glowing, it should be a great time, but sometimes it's not so comfortable. But as a woman who wants to have a very careful pregnancy, you're always careful about what sort of treatments you would have or what sort of drugs you ingest. And so what are some of the common complaints that you see in pregnancy, and how would you treat them?
Well, what I see a lot during pregnancy obviously is morning sickness. So for a lot of people it's not morning, it's all day. So often there's a weakness going into the pregnancy, so we want to deal with, obviously it's better if you deal with it before, but that's not always the case. So I'll see a lot of pregnant people for morning sickness. I see a lot of people for insomnia. Low energy is really common in the first trimester, so I generally tell people they might just have to ride that one out. But it depends on how bad it's getting. There is some stuff we can do to help it becomes completely pathological, but it is normal to a certain degree. Hemorrhoids is something that, believe it or not, we see a lot of, nobody talks about, but very uncomfortable part of pregnancy. High blood pressure. Believe it or not, actually slow for dates babies, which means you're doing your ultrasounds and you're finding that your baby is behind for where it should be. So instead of being where it should be at week 20, at week 22, whatever, you're behind dates. So generally we're looking at blood flow issues there, and we really want to work on increasing blood flow. So we do that through acupuncture in the nervous system. A lot of what we do, or what I do during pregnancy, is very safe for the baby, very safe for the mother, and if anything, it's going to help strengthen their system to create a better pregnancy. Low back pain is super common. I see that a lot. Towards the end I do, diabetes. Diabetes, I treat a lot of
diabetes. You can treat that
during pregnancy, especially
Chinese medicine?
Absolutely, especially if it's pregnancy related, because what's happening from a Chinese point of view to allow that to occur is the drain on the mother is so strong, they're actually putting it into a deficit situation, and it's showing up for them as diabetes. Other women will show up in other ways, like it might be eclampsia. But for diabetes, what we really have to do a lot of nourishing for the body, and that is usually enough to get them through the pregnancy without any problems.
Now, when you talk about a baby maybe not developing as quickly for term, or you're talking about nourishing, most people would just assume that it's just, I need to eat more. Let's face it, most
sometimes that's true. Sometimes that's true. Sometimes it is the diet they're choosing. A lot of this low-fat crap is not going to help you during your pregnancy. You actually want to have enough nutrients, and that includes enough fat in your diet for the developing baby. So sometimes it is a diet issue. Often though, they're going in an already weakened state, and pregnancy is it's hard on a woman's energy. It's not like being normal but fatter, which is how this society tends to treat it. It takes a huge amount of energy to create another person. So if your energy's low and you're pulling on it, you're gonna have certain pathology showing up. It'll be different depending on the woman. Right, towards the end I do a lot of work with getting them out. So acupuncture.
We don't want to keep them in forever.
Well, we tend to rush going into labor in our society, and we don't allow women their natural progression. So some women just take longer to gestate, but they're not always allowed to do that. So I'll generally start with pre-birth a couple weeks beforehand. And what I call that, or what I liken it to, is like ripening the fruit a bit faster. So we're just getting everything moving a little bit more, so the fruit's ready to fall off the tree a little bit sooner. Because you're not allowed a lot of time here to naturally gestate.
Well,
10 days past your due date, they're looking at going in, induction. Yeah, they're scared of risk, fair enough, I get that. But what we can do to help that is to help ensure a natural delivery if that's what you're aiming for. Not everyone is.
There's a lot of problems to be aware of, or at least challenges, common challenges. So.
Yeah, and I'm just touching on a couple here. We do a lot more than that, but those are the ones I see quite a bit of.
Okay. And to be able to do it without having to worry about anything invasive, anything changing your body chemistry, that's...
Yeah, well, we're changing body chemistry, but we're changing it in a positive way.
All right.
Yeah.
Okay.
Because we are making changes in the body.
And the ultimate goal, though, is a more comfortable,
healthy,
pregnancy.
comfortable pregnancy and happy baby. Baby and mom. And afterwards, too, we do work around, this is a really important one, work around increasing breast milk for women that are really low on that, because often that is a lack of blood in the body. So we give herbal formula, very safe, for increasing the amount of blood and therefore breast milk.
Well, yeah, because we focus so much on getting them healthy and then getting them out.
Then what do we do afterwards? Postpartum depression is another thing I see a lot of too, and often that's a case of being in, again, a weakened state that allows you to sink into this depression, I guess. But there's
an imbalance.
It's an imbalance. So if we work on correcting the imbalance, there's a lot we can do to pull women out of that before it gets, more severe.
So to be building up that balance all the way through the pregnancy, even.
In a perfect world, yeah.
All right. Well, thank you for indulging my curiosity, and thank you for joining us. Again, I'm with Dr. Angela Fingler, Doctor of Traditional Chinese Medicine with a specialization in fertility. So if people wanted to find out more or come in for a diagnosis or treatment, where can they find you?
They can get hold of me at acupuncturehealthcalgary.com or call the office 253-3103 or visit us down south in lovely Bonavista.
Okay, great. Thanks for joining us tonight. Have a good day.